Diarrhea is usually caused by viruses, bacteria, or parasites. Viruses remain the most common cause. Viral infection of the intestine leads to inflammation and injury and disturbs intestinal functions like digestion and absorption of water. This leads to the loss of lots of fluids and electrolytes in the stool. This watery, loose stool is called diarrhea. And if blood and mucus are mixed in such stool, it's called dysentery. It takes a minimum of 7 to 14 days for the intestine to become normalized again after such an infection, and it's a natural process. That's why diarrhea in children usually continues for 5 to 7 days. Parents need to be patient and keep hydrating the child with various fluids as suggested by the doctor. Diarrhea will improve gradually. As we know, diarrhea causes loss of fluid and electrolytes, which leads to dehydration. That is potentially dangerous for the child. So we need to replenish these fluids and electrolytes back into the body again. The easiest way for this is using ORS, meaning oral rehydration salts. Only World Health Organization recommended ORS should be used. They're available in 2 forms. A bigger pack available at all government health centers free of cost. It should be dissolved in 5 glasses or 1 liter of clean drinking water. While the smaller pack, available at all medical stores, is to be dissolved in 1 glass or 200 milliliters of drinking water. Instructions about the preparation of ORS solution is usually written on the back of the pack. Please read the instructions before use. Now, whenever the child passes loose stools, keep on giving ORS according to medical advice with a spoon and a small cup. This will prevent dehydration in the child. Once prepared, the ORS solution can be used for 24 hours. If the child is less than 6 months old, breastfeeding should be continued and ORS should be given when the child passes a watery stool. And if the child is more than 6 months old, use available fluids in the home like clean drinking water, lime water, coconut water, fresh fruit juice without added sugar, thin buttermilk, milk without added sugar, and thin moong dal. However, plain glucose drinks, coffee, packaged cold drinks, sweetened fruit juices, and ice creams should not be given. They can be harmful. Parents must continue feeding fresh, home-prepared, and easy-to-digest food to the child. It is very important to give zinc with ORS, as it eliminates diarrhea faster and reduces further episodes of diarrhea in the future. For this, we should give zinc in the form of syrup or tablets as per medical device for 14 days. Viral infection is the most common cause of diarrhea in children. So using antibiotics for it is irrational and harmful. That is why antibiotics should never be used in diarrhea without proper medical advice. Similarly, one must not use anti-motility drugs for rapid control of diarrhea. It may lead to grave side effects. Prevention of diarrhea is easy if we follow a few easy tips like breastfeed the child for the first 6 months of life. Wash hands with soap and water before eating and after defecation. Keep the drinking water clean and hygienic. Immunize the child for measles at 9 months. Vitamin A supplementation as per advice. Immunize the child with rotavirus vaccine as per medical advice. This information is given only to improve upon the general knowledge of parents. It is recommended that the child must be evaluated by the doctor first, and the doctor's medical advice should be followed judiciously.